Hey everyone, welcome to another podcast of Marketing 101 for Chiropractors. Very special guest for you this week, Dr. Kel Hargis out of New York. He's been doing this for a couple years. He's got some great information and a very cool book that he's got published that you guys can get into in a second here. He practices in New York. He's a chiropractic grad from Palmer, and he's been doing it for a long time. Thanks for being here, Dr. Hargis.
Nice to be here.
Yeah. Tell us a little bit about what you do and why you're so passionate about that.
Well, my specialty is in orthopedics. I think I practiced for about 5 years before I decided I wanted to go into that specialty. The reason I decided I wanted to go into that specialty is that we see so many things coming into our office that's not just spinal. So I wanted to broaden my scope a little bit. So I received my graduate degree in orthopedics from the New York University, probably in 1990. And so I've been practicing now for about 32 years as a chiropractic orthopedist. What I've seen is that patients coming into my office very often complain of pain in the spine, but very often outside of the spine. And in examining those patients, I often see that they have soft tissue injuries. If you think about it, when we injure ourselves, short of breaking a bone, the only injury we can really receive is to soft tissue. Soft tissues, of course, mean muscle, ligament, tendon, all the soft tissues that hold us together. And so when we have that sort of injury, we have internal damage inside the muscle or the tendon or ligament. And therapies that are very mechanical in nature, like massage, deep or vigorous spinal adjustments, vibration, rollers, muscle stim, heat, all of those things can actually aggravate and prolong soft tissue injuries. So there is a correct approach to treating those. So let's say that the majority of people I see um, might have a back problem. And that, in fact, is probably the major people I see. When they're indicating their back pain, they very often are not pointing to the spine. They're pointing to the paraspinal regions or to the gluteal or hip musculature. When you actually lay them down on a table and you start examining them and probing those areas where they're indicating that they have pain, you'll find inflammation and a very severe adversive reaction to your probing. In other words, they'll say, hey, that hurts like hell. And so it's pretty easy to actually identify these areas of regional tissue trauma. But the point of fact is that when you have muscle injuries, and they're the principal soft tissue injuries that you encounter, when you have that injury, you have an internal disruption inside the muscle. There may be hundreds or even thousands of fibers that are damaged. Some of those fibers are actually torn apart. And if we inadvertently or by design go in and are too aggressive with massage or stretch, or perhaps doing the wrong therapy, maybe muscle stim or applying heat, we're actually slowing down and preventing the healing of those injuries because basically those injuries have to repair. If it's in the case of a muscle injury, that muscle injury has to stay short and not stretched during its repair process. So these are things that I've been able to put together over the years in terms of my own methodology to treating injuries, and it's been extremely successful for me. Um, I have a ton of word of referral patients who come in. I don't do a lot of advertising. I've been very, very lucky to be effective in those treatments, and it's really boded well for my practice over these many years.
That's great. I mean, and you've put all of this information over almost, half a century into healing the human machine. That's your book.
Right.
You guys can find this on Amazon. I highly recommend getting the book because you hit a little heartstring with me in the pre-interview about, what we learn in school. And yes, we learned about the mechanism of injury, but that's it. And then you're left with a graduation and a thing to hang on your wall. And then you realize in clinic that, these people are actually really hurt.
Right.
Things linger. Things are actually not getting better. You learn through experience as you help more and more people.
Yeah.
And we all kind of spread out after chiropractic school. We go and search for more. A good clinician will always go and search for more. It doesn't mean you're getting more diplomas or more certificates, but you're always going to go learn more to help your patients. And it looks like you've done a lot of that.
You have to always add to your knowledge base and your toolbox, and you have to look around. You have to keep your eyes open and your mind open to not only what's happening outside your office, but certainly what's happening inside your office. So let me give you a perfect example. When I first started out in practice, I was doing almost like a spa type therapy. I had 3 or 4 massage therapists. People would come in, we'd put heat on them, we would massage them. They'd feel great. They'd walk out of the office saying, "Man, I feel so good." And the next day they'd be back in pain again. And I started to realize that, yes, many of these people had a spinal problem. Many of them had an imbalanced pelvis or a short leg or another mechanical problem or a subluxation of the spine. And yes, we needed to address that. But if we did all that and we didn't understand how to treat the soft tissue injuries that were occurring, we were doomed to failure. And so even though my practice was going gangbusters and people loved the massage and the heat, they just weren't getting better. Now, if you want to build your practice, the best way to do that is to be an effective practitioner. In other words, you want people walking out your door saying, Dr. Hargis took care of me. I went for 2 years to medical doctors, PTs, this and that. They were stretching me, they were massaging me, they had me doing all these exercises. No one ever asked me how I slept in bed. No one ever asked me how I sat in a chair or what chair I sat in at night. No one ever looked at my posture, my biomechanics, and so forth. I've been going to Dr. Hargis now for 4 to 6 weeks. I'm out of pain. That happened over and over and over again. And when people would walk out of the office and say, his approach was completely different, but I'm better now. I mean, you can't buy that kind of advertising.
No. And that was your pre question before the interview. Like, well, I don't know what has to do with marketing. I'm like, this has everything to do with marketing, because your reputation is the most vital aspect of marketing your practice and who you are. It's your brand. And a lot of us, because we're not familiar with marketing, and you've been very successful for all these years, and you even said it, I don't do much marketing. I just do good work. And I told you, well, that's why you're so successful, is because your brand recognition is so high in your community, because your track record is so good.
Yeah.
And,
I don't let, who does my marketing? Google does my marketing. Because if you go to search chiropractors in my area, or even in the Hudson Valley, and you look at Google, what you see there is 96 5-star reviews going back many, many years into the future, and no 4-star reviews, no 3-star reviews, no
good
2-star
reviews.
reviews,
Good
not
reviews.
even a 1-star review.
Yeah.
So and they're good quality reviews. They're reviews that people write when you've made a life change for them, when you've taken them from the depths of despair. In other words, I had a guy come in last week. No, 3 weeks ago. He's had lower back pain for 2 years at a level of 8 or 9 on a 10-point scale. Everything that he was doing and told to do by medical doctors, by PTs, was exactly wrong. He had a severe muscular strain of the lower back, and he was being told to stretch, massage, vibrate, and heat. So he was living with pain every day. We brought him in the office. We gave him a good examination. We identified his soft tissue injuries. We started doing the appropriate treatment, which in my case, I love to use ultrasound at full power for about 10 to 15 minutes on a given area. I have therapists that do that. We follow it with an ice pack. We'll advise the patient how to sleep and sit properly and other areas of ergonomics. We'll tell them not to stretch, don't vibrate, don't sleep on the side that's painful because you're stretching down into the mattress. Don't sit at your computer and lean forward because you're stretching out your lower back muscles.
Mm.
Same way with the neck or upper back. So there's all these things that you have to incorporate into their treatment plan. It has to include the proper therapy, avoiding the wrong therapy, the right ergonomics at home, the right postural considerations, even down to the right nutrition and nutraceuticals that they need to use to help them heal. And all of that from an orthopedist perspective in every area of the body, whether it's neck pain, shoulder pain, elbow pain, wrist pain, knee pain, foot pain, is all laid out in my book and encapsulated from all my years of experience. And I've got to tell you, it works beautifully.
Wonderful. Yeah. I mean, how many of us need to sometimes just reset and re-teach ourselves some of the basics that we think we've been doing? I mean, stretching is probably one of the most common mistakes for acute injuries. That's great. That's great advice right there. But Google, I'm glad you brought that up. I mean, your patients are doing all the work for you. They're just leaving you a review, and you've got a steady website that stays functional, and that's how they find you.
And I'll tell you another little tip too, if you don't mind me
Yeah.
saying, and this, because I know we've got a lot of docs listening out there. Once you've got that patient to a really good place, then you ask them, can you please give me a review? And you've got to ask them because they're not going to necessarily do it, even
No.
though they love you, if you don't ask them.
Right.
And one way that you can double their response is if you say, okay, I'm going to make a deal with you. I'm going to give you a roll-on analgesic, or I'm going to give you this or give you that, just as a little bonus for your doing the review. And when they walk out of the office with that little inexpensive thing, they feel even more indebted to give you that review. It's just a neat little trick that seems to work well.
Right. And you get an actual good review with a couple sentences and not just like, Dr. Hargis is great. That's great. And that's powerful because people read those reviews. It's really important. And then that's how you help more people with similar type conditions.
You
So
know,
that's
I'd rather have
great.
3 5-star reviews where a patient writes a page or a half a page than 5 reviews where they just leave 2 lines.
Right.
I'll always ask a patient, I'll say, you know what, you've been hurting for 2 years. You saw this specialist, that specialist, so forth. That's a very interesting story. When you do your review, would you please give us some of your history? And,
Yeah. Great tip.
that makes for a much better review.
100%. 100%. What else have you found that helping people in your community is a good way? Is it referrals? It's Google. And then how do you reach more people?
I think another way to advertise in your community is not going door to door and saying, "Hey, I'm the new chiropractor." It's to get involved with your community. In my case, I've been in Rotary now for about 38 years. I was the past president of Rotary in my town. I try to be active in a lot of things going on around my town. I go to a local church. I have 4 children. They're well known within the town. I mean, you are building not just a practice, you're building a relationship with
Yes.
the area you live in.
Yes.
And that's pretty important.
You get it, Dr. Hargis. I love this. It's absolutely great. Yes, get the book, folks. I mean, you're going to learn a couple things from there, and then I know on Monday you're going to change a couple things because you've been doing them incorrectly, and it's okay to admit because you're going to move forward and help people better, which is fantastic. In our practice, and I told you before this, it may not be ultrasound, but it is red light. It may not
Right.
be a heat pack, but it may be dry needling. It may be, there's modalities that are out there that you can do. And from a marketing perspective, when you're trying to develop your niche in your community, because that's important as well. A chiropractor, when you search it, a ton of them will come up on the website or on Google search. But what differentiates you is how you present yourself in the community and what you do through your work. So having a niche like you, orthopedics and sports injury, separates you from the chiropractic, back pain type doctors. Now people are calling you when they sprain their ankle or when they're hurt themselves on the weekend playing soccer. They know where to go and who's going to get them better faster. So that's really important too. And that's marketing in itself, is creating that reputation. So go to Amazon.com, look for Dr. Hargis's book, Healing the Human Machine, and get as many copies as you like. Would this be a good book for patients to read?
Oh, it's an excellent book for patients to read because it's written very simplistically. The therapy, the rationale, the spinal balance, there are so many components to this. But what's really interesting here, I believe, and I'd like to have all the docs listening understand this. They did a study. In my book, it's about nearly 300 pages. It covers, as I said, pretty much every orthopedic condition and how to treat it. But it also has about 270 references. They did a study about 6 years ago where they looked at all 141 medical schools in the United States. And what they saw, what they were looking for, and this was a panel of doctors, they were looking to determine how much training medical students got in the area of musculoskeletal diagnosis and treatment. And what they found when they looked at all 141 medical schools is that only 15% of those schools mandated any treatment whatsoever, or any
Curriculum.
study or curricula
Mm-hmm.
in the area of musculoskeletal diagnosis and treatment. And of those 15%, the schools that did mandate time for study, the study mandated the time was between 1 and 3 weeks. Now, I want you to think about that for a minute.
Right.
Okay.
Right.
So, in point of fact, here's the situation. When people walk into their medical doctor's office, he doesn't know the first thing about treating their musculoskeletal complaint. Not a thing about it.
Mm-hmm.
So he's completely shooting from the dark. That's why we got into this terrible opioid crisis. And part of the book is entitled America Drug Nation. And it talks about the whole cascade from poor understanding of these conditions to over medicating to the problems we have now with opioids. We have 4% of the world's population, but just a few years ago, we were taking 98% of the world's oxycodone and hydrocodone. Okay?
Right.
So, I mean, the references in this book that validate what we do over and over and over again, it's not only good from an understanding of soft tissue, it's really a referendum on the safety and quality of chiropractic and the expertise of chiropractic compared to medical doctors. There is a world of knowledge here in terms of not only soft tissue, but all those other aspects of that are so important for patients to understand.
Well said. Yes, absolutely. It's why we do what we do, right? Thanks for being a guest, Dr. Hargis. You did fantastic on this. This is absolutely wonderful. This will be out to everybody. And you get the book on Amazon. I'm going to say it one more time, Dr. Cal Hargis.
Can I show the book?
Show it. Yeah, let's do it. There it is.
Let's see if it's Healing the Human Machine on Amazon. There we go.
There it is. Calvin Hart. Perfect. Thank you, sir.
Matt. Appreciate it.
Yeah, no problem. Thanks for being on the show.
All right. Had a good time.